Thank you. Good morning. It's great to be back in Jacksonville. Very excited to be able to highlight this really great year that we're continuing to have on doing something that's very important to a lot of people in Florida, and that's fighting cancer. And there's a variety of ways to do that. I'm joined here. First, I want to thank Wolfson's Children's Hospital for having us and hosting us. We're joined here by our wonderful First Lady, my wife Casey, our Surgeon General, Dr. Joe Ladapo, our ACA Secretary, Siobhan Harris, President and CEO of Baptist Health, Michael Mayo, Allegra Jaros, of course, President of Wolfson's Children's Hospital, President of Johns Hopkins All Children's Hospital, Lisa Shuloff, President and CEO of Nicholas Children's Health System, Matthew Love, and then we also have many members of Nemours Children's Health. And we've worked with all of you guys over the years. I think we've done events at probably every one of your facilities over the years, and we really appreciate all you do, particularly for the pediatric care, and in this instance, what we're going to be able to do for pediatric cancer. We're also joined here by our Senator, Clay Yarborough from Jacksonville, has done a great job for you guys. As well as Reps Michael, Duggan, and Black. And I want to thank the doctors, researchers, and caregivers who are also with us here today, not only from Wolfson's, but also from our other premier children's hospitals, as I've mentioned, Johns Hopkins All Children in St. Pete, Nemours Children in Orlando, and Nicholas Children's in Miami. These institutions are helping to lead Florida forward in one of the most important fights that we face, and that's the fight against cancer. I don't think there's a single person in this state who has not been impacted by cancer, either directly or indirectly. Many Floridians are suffering from cancer or have recovered from cancer, including my wife Casey. Family members, neighbors, friends, coworkers. It really is something that has a huge, huge reach in terms of the impacts that it has on our state. And of course, we're not alone. This is happening all across the United States. And so we've worked really hard to answer the call, to do whatever we can do to make a big difference in this regard, because we know how wide the impacts, the positive impacts can be with some of the research that's being done and some of the other breakthroughs that we continue to see. Now, if you look at the state of Florida, so since 2019, not even including this year, what we're going to highlight, we've done over $800 million in cancer research and treatment funding, which is an increase of 114% from prior to my time. This year in the budget, you're over $200 million for the various initiatives that we have. And so that's a huge, huge token of support. And it should be noted, the way we approach this stuff in Florida, I signed a budget at the end of June that spends less than the previous budget, and that budget, after my line item vetoes, spent less than the previous year's budget overall in total. Not a lot of places are doing that, where they're very responsible with how you use the money, but we've also, over that period of time, paid off. So at the end of this fiscal year, we have paid off all the history of Florida, 41% of the state's outstanding debt. This fiscal year will bring us to almost 50%. Just in a 6 or 7 year period, we've been able to knock that out. Again, not a lot of other places are doing that. We've also been able to reduce taxes more than has ever been reduced in a similar period of time in the history of the state of Florida. If you look at our overall budget footprint, I hear, I got to follow these things in these other states because it affects us. They elect this guy in New York City. If they do that, you're going to see more people kind of move businesses to Florida. It's just going to happen. And I'm not even asking for that to happen. And obviously, I don't want Florida to replicate policies in places like New York. But the reality is there is a response that happens when you see failed policies put into place. And so we now have probably 4 million more residents than New York State. They're 19.5 million. We're probably pushing 23.5 million right now, but we're certainly over 23. So we have 3 to 4 million more residents than they do, and yet their budget is over twice the size of our budget. How does that happen? I know you wouldn't want to go to the DMV there. You'd rather get your license here. I know the roads are a lot better here. I know our schools are performing higher. So, you see this. So we've done it right. But even though we've done that and been very responsible with that, what we have done is focus on things that really make an impact for the state of Florida. For example, we've done more to increase teacher salaries, and we just did another $110 million increase, total of $1.35 billion for our teacher funding this year. We've done a lot to accelerate infrastructure projects because state's growing. We have areas of the state that have really bad traffic. You have some spots here in Northeast Florida, but you ain't seen nothing yet if you go down a couple of these spots in Orlando, a couple of these other spots. So we've worked to say rather than start those middle of next decade, let's start them now, let's finish them 5, 10, or 15 years ahead of schedule. So we took resources, we did that, and it's already having a positive impact, but that'll have a big positive impact. We also, last week I was down in Marco Island to sign a memorandum of understanding with the Army Corps of Engineers and the Department of the Army, because I've asked the President, delegate us more authority to be able to move these Everglades projects. We do our projects very quickly, and when there's hiccups, we take action and get new people in there to do it, which we did on the C-43 reservoir. But we can do some of this stuff quicker. President agreed, so we signed this memorandum. But if you look at what we've done in that space over my tenure, truly, truly historic. You've never seen anything like that in the entire history of Florida, and certainly in recent history. And so that is something that's going to have decades and decades of impact on Floridians in a really positive way for culture, for recreation, for clean drink water, all this stuff. So we've done that and dedicated huge resources. So we're doing things even as we're, and we have the smallest state government in America per capita if you look at our employees. So even as we're doing all that, you're seeing really impactful things done that really make a positive difference in the lives of Floridians. And I think that we're celebrating the success of this most recent budget with respect to all these items in cancer research and funding that are really, really important. And all of that was fully funded. All of that has come through. And I know people say, oh, well, this committee didn't know. It all landed. It all's doing what we needed to do. And I definitely want to thank President Ben Albritton of the Florida Senate. He's been a huge, huge advocate of this, as have other Senate presidents like Kathleen Passidomo, Wilton Simpson in the past. They really believe in this. And this is going to make a huge, huge difference. So what are we looking at here? Well, one, the Casey DeSantis Cancer Research Program was funded almost $130 million. That will strengthen the quality and competitiveness of cancer care across Florida. It will direct funds to Florida's 4 hospitals that have NCI designations and facilities that are seeking NCI designations. So we have Moffitt, we have Mayo here in Jacksonville, UF Shands in Gainesville, and Sylvester in Miami-Dade County. Supports a statewide biomedical research strategy, one that's directly responsive to the needs of Florida's patients and researchers. And this program has served as the backbone of the state's innovation efforts. We don't want to just support isolated projects, but we want to build an integrated statewide approach that drives long-term progress. This consortium of National Cancer Institute Cares Program was established by the Florida Legislature in 2014. 2022 was renamed after the First Lady in recognition of her successful recovery from breast cancer, and we're really pleased that we were able to do that. Under the First Lady's leadership, the Cancer Connect Collaborative is the first of its kind national model focused on accelerating research, sharing best practices, and turning data into action. Florida is really unique in doing this, and I think it's a really great innovative approach. We don't want barriers that slow progress. We're all in this together. We want to get the job done. And so you have guiding pillars of this collaborative data, best practices, innovation, honesty, and funding. And it brings together both public and private stakeholders to reshape how cancer care is delivered in Florida. Now, through the Cancer Collaborative, the state established the Cancer Connect Collaborative Incubator, which is now funded at $30 million. This incubator is designed to focus on areas of practice that are often underserved, like pediatric cancer treatment, which is only 1% of all cancer cases. Every 5 years, the collaborative will identify and specialize a new area of focus, and for the first 5-year term, that focus will be pediatric cancer, and that's why we have our Children's Hospital here today. So this makes Florida a major targeted investment in pediatric cancer research right here amongst our 4 children's specialty hospitals. And this will have a good impact, certainly, I think, in the near term, but over the long term, I think we're really building something that's really, really special. We want families, I mean, we obviously don't want families to have to deal with a case of pediatric cancer, but as long as that happens, we want them to know that they've got the best options right here in the state of Florida. They don't have to fly halfway around the country just to be able to get care for their son or daughter. And these hospitals, as I mentioned, Wolfson's, Johns Hopkins, Nemours, and Nicholas will be eligible for multi-year grants. It allow them to expand clinical trials, improve treatment protocols, and advance real-world cures. We're not just focusing on funding projects, we're focusing on achieving outcomes, and outcomes for patients. Florida's home. I mean, our population is 6.5% of the nation, and we have similar 6% of all nationwide pediatric cancer cases. We do have a clear path to keep more of our children cancer-free. We need to take that. And so this collaborative incubator is building on our investment in the fight against cancer. It is driving collaboration, eliminating silos, and making sure that groundbreaking treatments get to patients faster. Part of the reason we do some of this is not every research is likely to yield financial benefit. And also, like the private industry, they do a lot, right? But ultimately, they need a return on that investment if they're going to put a lot of private capital up. And so there's some things that may be a little bit more difficult. Maybe the prospects aren't quite as good. And some of the stuff may not ultimately be successful, but that's really the price you pay to be able to make some major breakthroughs. And I think the Florida Cancer Innovation Fund really follows through that. This was established in 2023. It just received it initially was funded at $20 million. It just received a $30 million support in this year's budget. And what they're looking to do there is support smaller startup and even rural entities. And part of that is just the fact that, yes, we have some big established institutions, and that's great, and we want them to do well, but there's also needs beyond that, and particularly in different geographical parts of the state of Florida. So this is something that I think is really going to make a difference, and here's some success stories in that regard. An initiative led by University of West Florida and partners to train rural healthcare workers to improve breast cancer detection in underserved communities. University of Florida's Plasma DNA Project aims to personalize treatment by identifying ineffective therapies earlier, minimizing unnecessary side effects. Mayo Clinic, researchers working to detect pancreatic cancer earlier by targeting earlier biomarkers, offering hope against one of the deadliest forms of cancer. And at FSU, scientists combining therapies to improve outcomes for BRCA-related cancers like breast, ovarian, and pancreatic. And those are just a few examples of how Florida is turning innovation into action. We have a strategy that prioritizes transparency, collaboration, and bold patient-centered programs. As of 2022, there are more than 18 million cancer survivors in the United States. In the next 15 years, sadly, that number this very, very terrible disease. And none of this would have been possible without the advocacy of my wife and our First Lady, Casey DeSantis. And, you know, when you have something happen like this, I mean, you know, there's certain times in life as people get older, they tend to have more afflictions. Not that that's easy, but when you were facing something like she was facing, mother of 3 very young kids, prime of your life, you know, you don't necessarily, you know, think that something like this, you know, may happen. Obviously, we know it's a possibility, but you just kind of, I didn't think it would happen to us kind of deal. And so when that did, you know, that was a big deal. It was a difficult fight, but I think her, you know, perseverance for that and really coming out on the other side with the help of some great folks at Moffitt Cancer Center down in Tampa, really she's now served as an inspiration for a lot of people who are also facing what she had to face. And everywhere we go, someone will come up to us and say that someone they know or even them has been inspired by her fight, and that's been important enough. But she didn't just sit on her hands. She said, how can we make a difference? How can we further this type of research, and how can we do things that will help people who may end up in her predicament? And so all the stuff we've done now to help against cancer in the last few years has really been under her leadership. So I really appreciate what she's been able to do, and it's my honor to turn the stage over to her.
Well, this is cool. I mean, I'm just so happy and honored and thankful for the legislature and the leadership of the governor to be here to have this historic announcement of how this benefits not only the community but the state as a whole. And I just have to tell you, you know, we've lost some friends. Judy Zatello, who is a hero in this community, who battled pancreatic cancer, I think for like 6 years. I think she would be looking down on us right now, very proud that we've been able to secure this funding and that we're able to really give people hope, because you remember her charity, Champions, still on there. Look it up, Champions of Hope. And she really was a driver in this community. You know, I've had the chance to meet Griffin. He was a patient. He's doing excellent. He was a little boy that lost his arm to cancer. I actually ran a 10K, and it was not the best experience for me because I should have trained a little bit more, but whatever. But I ran in his honor because I wanted to raise awareness about the struggles of what it takes to battle some of these deadly, very difficult diseases. And, you know, I just want to talk a little bit about my experience. You know, when you get that diagnosis, and I'll never forget because I collapsed into his arms when, you know, he was the one that answered the call because I wasn't strong enough to answer the call at that time to find out whether or not I had cancer. And so he was there to hold me as he's been through this entire process. But there are times where, you know, when you have a diagnosis like this, you go to bed at night and you want to wake up and you want to think everything was just a bad dream. But every morning you wake up and you realize that you're facing a reality of a cancer diagnosis, and it is extremely difficult. But every day you got to get up and you got to fight, and I'm fighting for my kids, I'm fighting for the governor, because I'm not going to quit. And so he says, you know, when you go through that, and, you know, I'm thinking about, you know, going through my chemotherapy, which was not the most pleasant thing in the world, but, you know, you got the cold cap on and you got the gloves on your hands and your feet so you don't get the neuropathy, and you're trying to watch Netflix, but it's kind of hard to watch Netflix when you're stuck to a bed for like 4 hours and you're trying to like deviate your attention somewhere else from the reality. But if you had told me then when I was going through that we would have secured this much funding to provide so much hope for so many people, I would have, I don't know, well, with this guy, anything's possible, but I don't know if I would have said that that's a reality. But I mean, I hope people realize just how special this is, how Florida continues to lead on behalf of the people who want hope, who want to benefit. There are friends that I know right now that are going through hell, and if they knew that the opportunities to be able to have hope, that they can get through it, just like I did, because the state of Florida is investing in ensuring that they have good outcomes and good treatments and good procedures and all of that. I mean, that's just very special. And so with the funding, with the Casey DeSantis, which you never really want to have something like that named after you, but I do appreciate, the fact that they did it, and it really is, special to have that continue to go on. But when you look at that, and you look at it going to the nationally accredited cancer institutes, and the Surgeon General and I were talking about this a little earlier, they're doing amazing things at Moffitt and Sylvester and UF and obviously Mayo, right in your backyard, amazing things. One of the things I think we're going to work on is ensure that whatever they're learning and whatever they're uncovering and best practices, man, we share that with everybody, right? Because St. Vincent's down the road, they need to know of the good procedures and all of the things that are happening, and these really great institutions that are attracting a lot of talent, that we're getting a lot of good research dollars. That's really important. The Innovation Fund is, I think this is huge. I mean, that applies to any hospital. Any novel technology or procedure or whatever can apply to the Department of Health. And really what's fascinating about that, too, is the grants go out quarterly. Because the Surgeon General, and we've talked about, we're at war with cancer. We don't want to wait for a fiscal year to then do all these grants. Like, let's go. If somebody knows that they've got a good idea and they want to put, gas on the brush fire to try to make an impact, like, you should get that funding quickly. And so Wolfson Children's, in addition to the funding that you got for your incubator with the pediatrics, you can apply for those funds. And let's go. Man, let's beat this thing. We're at war with cancer, and we need to win. And we're going to win in the state of Florida. I believe that because you have good people, good institutions, the backing of the taxpayer, and people who really want to make a difference. And then the third component of the funding, which is I think really important, and I wish Representative Garrison could be here. I know that he tried very hard to maneuver his schedule, and he's been a great advocate for your community. But we made a trip up here, and we met here at Wolfson. I don't even remember how long ago, like life comes at you fast, but it was a little while ago. And we sat around and we talked about the importance of incentivizing pediatrics. And if you think about it, it's such a small, thank goodness, a small percentage of the population who's dealing with cancer, right? Is it like 6%, 8%, or something like that of all of the cancer? So you have to invest in everything that's a little bit smaller, right? So the needles are smaller, the whatever you need to use to provide good services to children, the expertise and all of these things. You want to have hospital systems have the ability to be able to invest in that. And so now you're going to have, you already have 4 great hospital systems, but we're going to be able to incentivize them. So anyone across the state, God forbid they have a child who's diagnosed with cancer, they're going to know that they have 4 good, and beyond, right? But really 4 good specialized hospitals for pediatrics. And that's a big game changer, because you don't want, like,